So today we will be going over a simple primary care review on cold sore and fever blisters. So our case study is that a 12-year-old girl presents to clinic for painful skin lesion around her lips. The lesion started with tingling, burning, and pain around her lips yesterday, as well as several blisters developing today. She had a history of a cold and fever of 3 days ago. Allergies are unknown and immunizations are up to date. Her social history is that she lives with her parents and siblings. During the physical exam, we saw that she has small blisters and ulcers in groups on the lips. Palpable cervical lymph nodes are noticed. So our assessment is an HSV1 infection. What is a herpes simplex virus type 1 infection? It's a type of cold sore. It's transmitted typically through oral to oral. Its clinical symptoms are multiple painful blisters or ulcers. The clinical symptoms for a primary HSV1 infection is a gingivostomatitis and pharyngitis are the most common, while the reactive HSV1 infection clinical symptoms is usually a herpes labialis. So our diagnosis is an HSV PCR or culture. Treatment for the HSV1 virus is antiviral therapy or through cyclovir, PO, for 7 days given within 72 hours of symptom onset. Also, if it's too painful for the patient, we would usually give lidocaine pharyngeal viscous solution, and we would apply that with a swab or gargle. While prevention measures for the HSV1 virus is that patients should avoid kissing or sharing utensils, glasses, water bottles, towels, or lip balm during an active herpes infection. So, questions. What are the clinical symptoms of a primary HSV1 infection? So the answer would be a gingivostomatitis and pharyngitis would be the clinical symptoms of primary HSV1 infection. Our second question is, what is the clinical manifestation of a reactive HSV1 infection? The most common clinical manifestation of a reactive HSV1 infection is herpes labialis. And lastly, should the infected child be isolated? No, because the infected child cannot transmit the virus unless it is through contact only. Thank you for listening, and that's all.